How do team doctors affect fantasy football post-injury performance? Have you ever wondered how team doctors influence the performance of players after an injury? This is a key factor in fantasy football that can make or break your season. Team doctors are essential in managing player injuries, and their decisions can significantly impact fantasy football outcomes. They are responsible for diagnosing injuries accurately and determining how severe they are. This includes overseeing treatment and rehabilitation, as well as deciding when a player can safely return to the field. In fantasy football, understanding the role of team doctors can help you make better decisions. First, team doctors provide updates on player injuries, including recovery timelines and any limitations during practices or games. This information is vital for fantasy managers. If a player is limited in practice or ruled out, it signals that their fantasy output may be reduced. Next, we have the return-to-play decisions. Team doctors evaluate whether a player is ready to return without risking further injury. A cautious decision might delay a player's return, but it can improve their long-term performance. Rushing a player back can lead to subparing performance or even re-injury, which can hurt your fantasy points. Research shows that players often see a decline in performance after injuries, especially with certain injuries like ankle sprains. The rehabilitation protocols and return-to-play timing set by team doctors can influence how much a player's performance drops and how quickly they can regain their form. For instance, running backs and wide receivers tend to show significant decreases in fantasy points after ankle injuries. Team doctors also assess players' injury histories, which can affect your drafting and trading decisions. Players with a history of serious or recurring injuries may be riskier picks due to potential performance declines or missed games. Many fantasy football enthusiasts follow expert medical analyses or fantasy doctors who interpret injury reports and recovery trends. This can provide an edge in managing rosters effectively during the season. In practical terms, fantasy managers should closely monitor team doctors' injury reports and return-to-play decisions. Being aware of the medical context behind a player's injury can guide smarter lineup choices and trades. If a team doctor indicates a player is fully participating in practice and cleared for game action, that player is more likely to perform near their pre-injury levels. Conversely, if the player is limited or the return-to-play is delayed, it may be wise to seek alternatives. In summary, team doctors play a vital role in fantasy football post-injury performance. Their decisions on injury treatment and return-to-play timing influence how quickly and effectively players can return to contributing points. Understanding their evaluations and communication can help fantasy managers optimize their rosters during injury recovery periods.